Hi, this is Scott Ritchie, and today I will be talking about adaptive pressure control ventilation in regards to how does it react during transient events or changes in patients' inspiratory flow. I will also contrast this and compare this to other modes of ventilation, one volume control ventilation and pressure control ventilation. So what happens when there's a change in inspiratory demand, when the patient is sleeping and then awakes, or the patient is repositioned in bed or is having a painful experience? Let's find out. Thank you. During volume control ventilation, my flow rate is a fixed flow rate based on my setting of flow. So as you notice on my ventilator variables over here, that with a fixed flow rate, I'm generating these pressures in my patient here for the same tidal volume. However, during transient states of variable flow, the only way to increase my flow to the patient or decrease the flow to the patient is for the practitioner to actually change my flow rate. So say there's an incidence where the patient's under sedated, they're very agitated, or they spike a fever and their minute ventilation demand goes up, and they need a higher flow rate. The practitioner has to increase the flow rate. And as you notice, when I increase my flow rate, that's going to change my pressure also, my generated pressure. Say the event was transient. I still have this high flow rate set and the patient doesn't need as much flow. Or another example is during sleep states. Patient's flow demands decreases a bit. So this flow rate might be too high and offloading the muscles too much. So one would have to come in here and decrease the flow rate again. So during volume control ventilation, my flow rate is always fixed, and the practitioner has to adjust it during transient events. Okay, this is pressure control ventilation. As you can see, the top right hand portion of the screen where my cursor is, we have pressure control, and here's my current settings. I have pressure control 12, and if you open my controls, I have a respiratory rate of 10 here. And my trigger is very sensitive. It's only set at 1 liter per minute. I'm just going to close this out. What I want to focus on is what happens during the transient events, what happens when the patient's drive or effort increases or decreases. So we're going to look at a couple things. One is this purple flow waveform. And this is to highlight that my flow is going to be variable in pressure controlled ventilation, so it's going to meet my patient's inspiratory demands when they increase or if they decrease. Another thing we want to focus on, though, is my tidal volume and what's going to happen with my tidal volume when my patient demand goes up or decreases. Now currently we have a measured rate of 11, even though I have my patient rate set at 5. And this might be because the simulator, I don't have the effort high enough. So I only have the patient effort of 5 centimeters of water, and they should be able to trigger the breaths on that sensitivity I set for the trigger. As you notice, our peak pressure is 17, and that's from my pressure control setting of 12 above my PEEP of 5, so that's a peak pressure of 17. And this is going to remain stable. Now let's look what happens when I increase the patient effort. So I'm going to just change the patient effort. This would be an event like sedation's wearing off, patient's in pain. They might be giving the patient a bath, turning the patient, or it might be a wake state. So I might have started out in a sleep state. And I'm just going to increase this to 10. And let's see what happens with my flow. So I currently have a flow. It's probably around 60 or 65. And you notice my flow waveform immediately is going up. So it's increasing a little from the baseline to meet my patient's inspiratory flow demand because their effort has changed. One other thing you might notice too is my measured values. So my measured values, my tidal volume's increasing a little. And my measured values over here are average about 4 breaths. I'm going to select my patient effort again. I'm going to change this to 20. Say the patient's really agitated. And let's see what happens. So you notice my pressure remains fixed, however my flow is variable, dependent on my patient's inspiratory drive. So that was a spontaneous breath, that was a mandatory breath, didn't need as much flow. And as you see, as my inspiratory drive increases, my flow rate increases also. So here's some mandatory breaths, and that was a spontaneous breath. And my flow rate increased to 75. As you notice with these breaths too, my tidal volume is getting a little bigger. So even though my flow is variable, my tidal volume can either increase or decrease. And I'm going to just make this dramatic, and I'm going to increase the inspiratory drive all the way up to 30 centimeters of water. And let's see what happens to my inspiratory flow rate. So this is why pressure control is different than volume control. Where volume control, I have a fixed flow rate. During pressure control, I have this variable flow rate to match the patient's inspiratory drive. And we look at this flow waveform here, and we look at our mandatory breaths, and we'll start seeing some spontaneous breaths, and it goes off the chart. It rescaled the flow waveform. And my flow is way over 75 now. So when my effort decreases, I'm going to go back down to 5 or 4. My flow rate's going to vary again to match my patient's demands. Okay, I switched my simulator to adaptive pressure control, and that's what this CMV Plus is in this ventilator. And if we look at my settings, I'm going to go under my controls, and you can see I have a target tidal volume of 600, a set respiratory rate of 10, and I have that since the flow trigger here. So as you notice on my patient side, I have a patient rate of 5 and a patient effort of 4. So low patient effort right now. And we'll look at our measured values here. Currently it's taking only a pressure control of 12 centimeters of water to get this target tidal volume of 600. So we notice the measured value of 584, basically 600. And I have a total respiratory rate of 16 breaths per minute. And as you look at my flow right now is probably around 60 liters per minute if we look at this purple flow waveform. Now with adaptive pressure control, it does fairly well with transient events. So when you're turning the patient's getting a bath, they might become a little agitated, or they can have their sleep state. What's different with adaptive pressure control is I still have this variable inspiratory flow pattern, but it's going to target a tidal volume based on my tidal volume setting. And I'm just going to demonstrate that. I'm going to increase my patient effort. Let's say the patient got really agitated. So they're currently, let's say, in a sleep state. And I'm going to show you, I'm going to make them pretty agitated. I'm going to just change their effort to 20 centimeters of water. So let's select that. We're going to look at my flow pattern, this purple waveform here. As you notice, my flow is 75. And this might take a little while. As you know, oh, there we go. We see it, the flow going off the chart here with my vigorous breaths. My tidal volume has gone up, just similar to pressure control ventilation. However, what adaptive pressure control is going to do, it's going to decrease my driving pressure. So as you notice, it's decreasing it quite dramatically now. We started around 17, and now my pressure's gone down to 12. So it's a decrease by 5 centimeters of water to get that target tidal volume of 600. So as you notice, my mandatory breaths, the flow is pretty low. It's only around 45 or in the 40s. However, my spontaneous breaths, the patient's inspiratory demand is still a little high, so it's giving the patient a lot more higher flow rate. Now, if the patient calms down, I'm just going to decrease the drive again to 5. The flow is variable again. The patient doesn't need as much flow. And what happens is, since I don't have a high flow, my tidal volumes are not going to be as high. So what happens is, during adaptive pressure control, it's going to have to increase my peak inspiratory pressure now to maintain this tidal volume of 600. And as you can see, my peak inspiratory pressure starts to rise to maintain this target tidal volume of 600. And this example of how adaptive pressure control responds to various variable flows and transient events. As I mentioned, it does pretty well with some transient events. However, this happens more often. Say a patient's breathing pattern is very irregular. I would not recommend adaptive pressure control. You're going to have too much tidal volume variance, and the peak inspiratory pressure, the driving pressure, is going to change quite a bit. So any patient with a neurologically impaired breathing pattern, example is Shane Stokes or Byatt's breathing, I would highly not recommend adaptive pressure control. But for minor transient events, you can see by the example, adaptive pressure control does very well. It meets the patient's inspiratory flow demands, and it maintains a target tidal volume.